Good morning, good people. Episode 2 of short video lectures for ClinPath 2 in preparation for the VTNE. By request, we have blood pathogens of veterinary medical importance. And through this lecture, guys, as I condense this, we're going to focus on those that you might be able to see visually on a blood smear. The one big take home that I would tell you from all this is that, with the exception of cytozoan, because cytozoan is often present, like all of these we have better ways to diagnose these diseases than a blood smear for the most part. So we have ELISAs, we have PCR testing, and all of those are going to be much more sensitive tests and sometimes more specific tests than just trying to evaluate a blood smear. But I did want to go through the blood parasites. First up, super important, is our heartworm, Dirofilaria immitis. Please remember that Dirofilaria is a nematode, and it is further classified as a filarial worm, the causative agent of heartworm disease. I know you guys know that. The dog is the definitive host, but heartworm can also affect cats. Thus, we have them in heartworm preventatives. Wolves, coyotes, jackals, foxes, sea lions, and humans. Did you know that you and I could get heartworm disease? Our bodies do a pretty good job of fighting it off because we're not the normal host. But there are reports in the literature of human infection with heartworm. It is transmitted by the mosquito, and there are a bunch of different mosquito species that can transmit it. So it is not direct transmission from dog to dog. It requires a vector parasite. Best resource in terms of treatment for heartworm disease is always going to be the American Heartworm Society website. But I did include on here the drug that we use to treat adult heartworms, which is called melarsamine, and that is imiticide is the trade name. Those deep intramuscular injections, of which we give a series of them. Optimally 3 is gold standard. All right, life cycle. This is going to be super important for you guys to know as you get into practice, because you're going to be having the heartworm talk like all day, every day with clients. You've got to understand it. So you've got an adult heartworm living in not the heart, mind you, but the adult heartworm lives in the pulmonary arteries, guys. So it lives in the pulmonary arteries going away from the heart. Only in cases of massive infection do those worms actually start to back up into the heart itself. And in that situation, if those worms cross over across the tricuspid valve, then we have a dog that is set up for what we call caval syndrome, which I saw a lot of in Mississippi. But adult heartworm in the heart produces baby heartworms. Those are what are called the microfilaria. Those are L1. That is what we're looking for on our Knots test, or what you might see on a blood smear. That L1 is ingested by a mosquito when it bites a dog. And within the mosquito, it becomes an L2 and an L3, and then the mosquito bites yet another dog, or possibly the same dog, and injects that L3. And from L3 to L5 is when that becomes an adult in the canine. All right, so what you need to know in terms of identification is occasionally you will see a microfilaria on a blood smear. You will definitely see them if you live in a heartworm endemic area and you are regularly doing the Knots test, which is a part of your required skills. But to be frank, I think this is one of these dumb things that is kind of out of date. Not a lot of people do Knots testing anymore because we have such a good antigen test. But I will make an argument that it is important to know whether a dog does have microfilaria as you begin to treat it, because it may affect what type of preventatives you have. Sometimes you can actually see these little microfilaria wriggling under a drop of blood on the microscope. If I had a low budget client in Mississippi with a coughing dog, I'd take a drop of blood, put it on a microscope, put a slide over it, and look for these little suckers jiggling around in the blood. They're all over the place in high positive heartworm dogs. One other thing you can do is you can take a Buffy coat. You can take the PCV tube, so spin it down, look at the Buffy coat underneath the microscope, and sometimes you can see these little microfilaria wriggling in that Buffy coat, which is kind of cool. Important question. What stage of the life cycle is this that you would actually see on a blood smear? So I want you to be able to sort that out. Trying to advance my slide. There we go. All right. one thing to know for VTNE, and I think this is dumb, but it does come up in the VTNE prep questions, is that there is another non-pathogenic, meaning disease-causing filarial worm. They used to call it dipellinemia when I learned it in school, but they have changed the name, as they often do in science, to Acanthochylinema recondidum. So there are morphologic differences between heartworm and this non-pathogenic parasite. So if you are in a practice where you are regularly doing NOTS testing or you're regularly evaluating blood smears and finding microfilaria, it is important that you don't mistake one of these non-pathogenic worms for a pathogenic Dirofilaria immitis or heartworm microfilaria. These recondita, this one on the top is the recondidum. It's shorter and it has a more blunt head, and its tail is curved slightly compared to a straighter tail, a more round head, and a longer body of Dirofilaria. But again, I think that is an antiquated type of question. All right, next up is Babesia. So Babesia is a red blood cell parasite. It undergoes asexual reproduction in the red blood cell itself. So what you are going to see clinically in animals that are affected with Babesia is symptoms that are consistent with hemolytic anemia. So you get that prehepatic jaundice or icterus due to the excess heme breakdown and the liver getting overwhelmed. Babesia is tick transmitted. It is transmitted by the Rhipicephalus species of tick. In cattle, we call those Buophilus now, but we still call them Rhipicephalus in dogs for whatever reason. The cattle get different forms of Babesia, and importantly, dogs get different forms of Babesia. There are two major forms of Babesia. It's Babesia canis and Babesia gibsoni. And the Babesia gibsoni are a little bit smaller, but you often have them in these little pairs, Babesia, these little pairs inside the red blood cell. And I have seen a good amount of Babesia gibsoni in Mississippi. We have a ton of pit bulls. For whatever reason, we think pit bulls are a little bit more susceptible to Babesia gibsoni. And Babesia gibsoni is weird too, because it is suspected that it can be transmitted through potential bite wounds, which makes a lot of sense why I would see a lot of Babesia in Mississippi, because we had a lot of pit bull fighting in the Mississippi area. But there's a suspicion it can also be vertically transmitted, so from mother to pups. All right, here's one you got to know, guys, and I hope that you all do know it. It is Cytozoan felis. This, by far and away, I feel like I traded heartworm in Mississippi, because I saw heartworm all day, every day, for Cytozoan felis in the Ozarks. Cytozoan felis is the pyroplasmic agent of bobcat fever. It is primarily transmitted by the Lone Star tick. And what it does is, upon that tick bite, this organism goes in, this little pyroplasm infects your macrophages, and it starts to asexually reproduce. And so these macrophages get huge and full of all these cytox, and they basically start to rupture and get released into the circulation, which is where we can see it on these red blood cells. So up here, since I moved up here, I have learned that any cat with a fever gets a blood smear here in the Ozarks, because there's a really good chance, particularly if they're outdoors and particularly if they're not on tick prevention, that bobcat fever may be the causative organism. And I like this about bobcat fever because it is so important to try to diagnose these guys quickly so that we can start therapy. Because I have seen so many cats die of bobcat fever in the 5 years that I have been up here. But these guys run fever. There are microthrombi and massive inflammation that goes on in the body with this parasite. And so these guys come in hot. Often when they're towards the latter stages of the disease, they'll also be jaundiced, and they can be jaundiced from pre-hepatic icterus or hyperbilirubinemia. Sometimes they can be jaundiced because these parasite thrombi go everywhere and you've got inflammation of the liver, but most often it's a combination of both. On a CBC, what I most classically will see is a CBC in a cat that looks a lot like parvo in a dog does. We've got an anemia, you've got a very severe leukopenia, and you've got a very severe thrombocytopenia as well. How we treat these, I've kind of found that a lot of places have their own little protocols for how we treat them. I am not sure which one is best, but the parasite people still are recommending a combination of atovaquone here, which is an anti-malarial drug, azithromycin, which is one of our antibiotics. It's also recommended that when possible, we anticoagulate these guys because they get these thrombi because of the massive inflammation in their body. But enoxaparin is probably the safer one of the two to do subcutaneous injections of, and then tons of supportive care. So these guys get pain meds, they get fluids, they get sometimes we'll treat them with steroids, sometimes we'll treat them with clopidogrel. We say a lot of prayers for these cats because I am not sure if these guys really survive because of our treatment or if they survive in spite of our treatment, in all honesty. I think some of these guys are just going to die no matter what we do. I think some of them are going to live no matter what we do. I've seen kind of all over the map with this. There is some thought too that some cats can be chronic carriers of cytox as well, but the bobcat is the reservoir host for this organism, and the bobcat does not seem to get clinically affected by this disease. All right, we're going to move on to some less common ones here. Trypanosomas are a giant group of parasites, and there are trypanosomas that affect all different species. Trypanosomas are generally a vector transmitted disease, so most of them go through some sort of insect or arthropod. In Africa, they are transmitted by the tsetse fly, and this is where you'll see African sleeping sickness is a trypanosomal organism. But these guys are really sneaky and really creepy, and I'm really glad we don't have a ton of trypanosoma here in the U.S., with one caveat. I'm going to tell you that in a minute. But these guys get into, from the bite of the vector, they get into the lymph and the lymph nodes, and then they get into the bloodstream, and they reproduce. And they live in the endothelial cells of the capillaries, and they cause massive inflammation. And so the spectrum of illness that you can see with this is everything from fever and anemia to weight loss to just poor doing. There's a couple different types of trypanosoma to be aware of. One is called Sura, which is a different trypanosome that is transmitted by not tsetse flies. And then there is one in horses that is present in South America that is called doe urine. And this trypanosoma is kind of unique because instead of needing a vector to go through, it actually can be transmitted via sexual contact. So it's pretty interesting for this category of parasite. Now, that is what a trypanosoma might look like if you found one on a blood smear. I have never definitively diagnosed a trypanosoma case. I did have a professor who inadvertently stuck himself with a needle from a trypanosoma positive dog, though, and then had to have himself tested for years and years. But they look like these little flagellated eukaryotic organisms that can cause a wide variety of disease. Now, this one I do want you to know about, not because you'll necessarily see it on a board question, but this is Trypanosoma cruzi. It is the causative agent of Chagas disease, and it is transmitted by this little creep show up here called the kissing bug, and these are called triatome bugs, and we have them in our area, guys. This disease condition that Trypanosoma cruzi causes is called Chagas disease. And this particular species of Trypanosoma is really strange because it demonstrates this word right here, which is tropism. That means the parasite has a particular preference for a tissue type. And in this circumstance, where this parasite likes to go is it loves to go to cardiac muscle. And so this is an emerging disease in the United States, and we're seeing higher and higher incidence rates of it, both in people but also in dogs, as you approach that Mexican border. My buddy Shelly that works in Austin, she worked for a cardiologist. They have lots of Chagas dogs up there, and most of the time these guys don't act ill, and this is also true for people. You don't act ill until there's so much damage to the myocardium and that heart muscle that they have cardiac arrhythmia or signs of right-sided heart failure or myocarditis. Here's the one other tricky thing about it is there's no approved treatment in the United States for Chagas disease. And the other thing to know is that it's not easy to diagnose either. Like, we have some antibody tests for it, but because it likes to burrow in the tissues, it is really, really tough to diagnose. All right, on to the next one here. This is also considered an emerging disease. And so from a public health standpoint, this is an important one to know. It's called leishmania. And this little dog down here, I unfortunately have my face on here, and so I won't be able to show you the whole face of the dog. But leishmania organisms, they're much more common in Central South America, Middle East, Asia, and Mediterranean. They are transmitted by the bite of sandflies, and this disease can affect, you see it here in what's probably a macrophage as it's reproducing. It can produce these skin lesions, or it can go into organs, and this thing can also be transmitted from mother to pup. So eye abnormalities, skin lesions, and epistaxis or nosebleed are common signs. And this is a reportable disease. So if you have one that you get a definitive diagnosis on, either by biopsy or PCR, this is a reportable disease because of the zoonotic potential. Cytology of skin and organs. The best treatment for this, unfortunately, is just to prevent it. And so keeping these flies off of the animals with a impregnated collar with a permethrin based in there, or imidacloprid, which hopefully you can recognize as the active ingredient in Advantage. So a preventic type collar, permethrin, imidacloprid, can protect these guys from these sandfly bites. I'm not even familiar with this drug, but I just threw it in there for you. But this is a real big public health problem in a lot of parts of the world where this disease is endemic, and it looks like they're trying to develop a vaccine for it in other places in the world, but just one of those to know. All right, anaplasma. Anaplasma is transmitted primarily by Ixodes ticks. It can affect cattle and sheep, goats, and dogs. I would say clinically, we see most of it in cattle and dogs. On our 4DX, I believe it is heartworm, Lyme, Ehrlichia, and anaplasma testing on there. So you may get an anaplasma positive dog on a 4DX test in hospital. It acts a lot like our other rickettsial type bacteria, in that it can cause some hemolytic anemia and fever. And tick control and doxycycline is going to be the way to go in terms of treating these guys. On to Ehrlichia. That's another component of our common 4DX test that we use in hospital. There are a lot of different types of Ehrlichia, and Ehrlichia is classified as a rickettsial disease, and most of our rickettsial diseases are tick transmitted. They can be transmitted by amblyoma. They can be transmitted by Ixodes ticks. In dogs, we will often see high levels of ALT and AST, as well as a mild to moderate thrombocytopenia and potentially a mild anemia. People get Ehrlichia too. You can get Ehrlichia canis, you can get Ehrlichia uni, and we have flu-like symptoms, fever, low white blood cell count, and low platelet count. And all of the ehrlichiosis can have acute, subacute, and chronic manifestations as well. Most of our Ehrlichia live in the white blood cells. Here, there's one type of Ehrlichia in dogs that primarily likes the platelets, but most of our Ehrlichias live in the white blood cells. And this cute little man, who is unfortunately now deceased, this is Dr. Sidney Ewing. He was actually one of my professors at Oklahoma State when I was in vet school. And he discovered a strain of Ehrlichia that's actually named after him, Ehrlichia ewingi, and it's also called canine granulocytic ehrlichiosis. So it likes to get to the neutrophils predominantly. So one thing to note about our Ehrlichia tests in our 4DX screens is that they are antibody tests, guys. So if we get a positive Ehrlichia, it does not mean that the dog has Ehrlichia. It means that the dog has antibodies to Ehrlichia, and those are two different things. So once a dog tests positive for Ehrlichia, they're probably going to have antibodies their entire life. And so what that only means is that they've been bitten by a tick that contained Ehrlichia, and their body has made antibodies to it. However, if you have a dog that's febrile, whose CBC and chemistry are kind of fitting the bill, the clinical picture fits the bill, and they're Ehrlichia positive on that 4DX, you would definitely definitely be remiss to not recommend some doxycycline that your veterinarian prescribes some. But that being said, if you get a positive test and you're not sure that this dog really fits the bill for Ehrlichia, the next thing to do is to send off a PCR test, which is actually testing for the presence of the organism DNA rather than antibodies to the organism. All right, mycoplasma. We will see mycoplasma a good bit in cats in this area. We used to call it hemobartonellosis, but again, we like to rename things in medicine, so now it is called mycoplasma felis, and that's where you're going to see it most common. It is a rickettsial type of organism that can also be treated with doxycycline and azithromycin, and this is the causative agent of feline infectious anemia. We do find that cats that have retroviral diseases, so FIV positive cats, feline leukemia positive cats, are going to be more at risk for this disease, and we believe it's transmitted through fleas. There are types of mycoplasma in all species. We don't see it very often in dogs unless they're splenectomized or have other immunocompromise. You will also see it in cows and pigs in particular, it's transmitted by pig lice. It's kind of creepy. But doxycycline or azithromycin. And then we do have questions as to whether or not if we can successfully treat these cats, but the big question is, can we actually clear this infection in cats? And the answer is we just don't know yet. All right, here's a little bit of an oddball one that I've seen a couple of these down in Mississippi. I have not seen one confirmed since I have been up here in the Ozarks, but this organism is called hepatozoan, and there's two types. There's hepatozoan canis and hepatozoan felis. This is a tick-transmitted disease, but this one's weird. It has a unique identifier. The dog has to eat the tick in order to get this infection. And hepatozoan classically causes fever, muscle pain, because these little organisms infect white blood cells, but they will also insist in the muscles. And this one, and I've seen this twice, this organism, the body has a weird response to this organism, and animals, and particularly dogs, can develop like really severe periosteal proliferation with this disease and disorder, and they tend to get this really thick, nasty mucopurulent ocular discharge as well as run high fever. And many times their white blood cell count, guys, I've seen some of these hepatozoan dogs, of the couple that I've seen that I've confirmed, have white blood cell counts like up in the 70, 80,000. So really high fever, really high white blood cell count, stiff, painful, history of tick exposure. They do have a better PCR test for hepatozoan nowadays, but previously, like when I first got into practice, the way that we diagnosed this disease was actually through muscle biopsy, was the way that the confirmative diagnosis. How do you treat it? It's also a really tough one to get rid of. It's a similar organism to toxoplasma in cats, so the treatment regimen is similar. So trimethoprim sulfa, clindamycin, and a drug called pyrimethamine. And then long term, if they stabilize, we put them on something called decoquinate, which is actually a poultry coccidiostat that is used in poultry houses. But again, questionable as to whether or not they actually ever cleared the disease or are cured of it. And if you can get them over these humps, it does become kind of a quality of life issue. And then histoplasma and blastomyces, it's not a parasite per se, but these are fungal infections. You can often find histoplasma, and this one is histoplasma, in our white blood cells and monocytes in a blood smear. Not always, and again, we have better ways to test for this, and the urine serology test through MiraVista is the best way to actually test for histoplasma and blastomycosis. These organisms, they are fungus, they are actually yeasts, and they are everywhere in the environment. But bird feces is a real common way that histoplasma gets transmitted in the environment. You can walk it in on your shoes. We do know that animals and people as well that get these infections systemically, because most of us are exposed to these organisms, but we have healthy immune systems and can fight them off. We do think immunosuppression is a risk factor for these guys. How do we treat it? Long-term treatment with itraconazole. That is the safest drug to use in these guys. And when I say long-term, it is months and months and months. And then again, question mark, do they ever clear it? All right, and then last but not least is just kind of a more of a scholastic red blood cell parasite. I've never seen this. I have seen distemper, but I've never seen, probably haven't even ever looked for inclusion bodies from distemper virus. And they can happen in red blood cells and they can happen in white blood cells as well. But you don't see them very much. Again, it's kind of an academic exercise. We know it can happen, but again, we have better tests for it than evaluating a blood smear. But just in case that one ends up on a VTNE review, wanted to throw that one in there because it is in your hematology books. Those pictorial hematology books that you guys have as your curriculum, this veterinary hematology, this does have some nice pictures of some of these organisms, as does the eClinPath website. But hope you enjoyed it. I'll see if I can't make this one into an ed puzzle as well. And we will go to cranial nerves is the next request that I've had. Cranial nerves. So keep them coming, y'all.